Welcome everyone, thank you for joining us today. I'm Teresa Marentet, CEO and Chief Nursing Officer of the Windsor-Essex County Health Unit. I will now report our current case counts. There are 337,555 confirmed cases of COVID-19 in Canada and 105,501 cases in Ontario. Chatham-Kent has 480 cases and Sarnia-Lambton has reported 401 cases. Michigan now has 314,216 cases, with 18,875 cases being in Detroit. Today, we are reporting 55 new cases of COVID-19 in Windsor and Essex County. Of the 55 new cases, 18 are residents of a long-term care home, 13 are close contacts of confirmed cases, 5 are agri-farm workers, 1 is a local healthcare worker, 1 is travel related to Michigan, 1 is community acquired, and 16 are still being investigated. We have had 3,381 cases since March. 2,989 cases are now resolved, and 315 cases are active and being followed by our health unit. 16 people are currently in the hospital, and 5 people are in ICU. Our community has lost 77 people to COVID. 54 deaths have occurred among residents in long-term care and retirement homes. There are currently 5 long-term care and retirement homes experiencing a COVID outbreak. 3 workplaces are in outbreak. 2 are in the agri-farm sector, and 1 is in a place of worship. There are 2 schools that are currently experiencing an outbreak. And there is 1 community outbreak. 1 was rescinded yesterday, but a new outbreak has been declared at a lodging home. For testing of COVID-19, testing is available by appointment at selected pharmacies and assessment centers. Please call in advance to book your appointment and determine your eligibility. Windsor-Essex has 2 assessment centers, Windsor Regional Hospital, Olette Campus, and Erie Shores Healthcare in Leamington. SOHAC in Windsor also offers testing for First Nations, Métis, and Inuit people and their families. Please continue to visit our website at wechu.org for further information and updates. I will now turn it over to Dr. Wajid Ahmed, our Medical Officer of Health.
Good morning and thank you for joining us today. We continue to see more and more cases in our community, and I'll continue to emphasize that we are following a dangerous trajectory with the number of cases in our community. The second wave is in fact affecting every sector and every individual in the region. We now have cases in the long-term care home, retirement home, agri-farm sector, community outbreaks, and large number of cases in our community. Our staff is working really hard to stay on top of everything, but we need your support. Please limit your number of close contacts to reduce your reduce your risk of contracting the virus. Since yesterday, we are adding 2 additional cases in students from Begley School. Now we have 41 cases, 31 confirmed cases in students, plus 2 probable students, and 8 confirmed cases in staff. We are working closely with our school board partners to contain further spread in the community. In addition, as Teresa mentioned, we have declared a community outbreak in a lodging home in Windsor. We are working with all our health system partners locally to offer testing, isolation, and support to the residents that are affected by this outbreak. It is critical that we take all the precautions to protect ourselves and protect our loved ones and limit the transmission in our community. Thank you.
We'll now take questions from the media. Today we'll start with CBC.
Yes, good morning. So the school board yesterday, the public board that Begley's under, they told us yesterday that they don't have demographic or profile data really of the school and the school community. But I know that you guys at the health unit have said that you've provided communications and certain supports. I'm just wondering, how do you guys know how to help out and to cater to this demographic, like what sorts of supports they need and languages they need if this information is not really available?
Well, it is available. We do work with the school boards and the school principal to determine the needs of their school communities. So if there are language needs or any other identified issues that we can assist with, that is a communication between typically the school principal and our nursing staff. So that's kind of how it all works.
Okay. And I'm wondering, so yesterday when you guys supplied, there was a graph that said on November 8th was when the person first became symptomatic in the school, and then November 15, it said that a specimen was collected. I'm just wondering, was the staff member going to school at this time, like during that week? Were they symptomatic and still attending the school?
So the symptomatic case that we're talking about is the when you have the case, we obviously go back in time to identify when the symptoms started and who was the index case. So some of these details, it doesn't mean that the person was symptomatic and continued to come to work. The information sometimes it's all mixed up together, but all I can say is the person had mild symptom when during the school that prompted and triggered us to do our investigation further and expanded the investigation. It's not that the person attended the school. So mild symptoms sometimes, as we all know, can be missed by individuals, and that's why it's really important to be mindful of everything. And if there's any evidence of doubt that you have any symptoms, and especially if you're working with high-risk population, it is really important that you take that measure and stay home. From this, I can only say that the person was symptomatic while they were there, mild symptoms, and at the moment they recognized it, they were removed immediately from that workplace.
Okay, so between November 8th and 15th, they did attend the school and were symptomatic, though?
I don't know if that was the same person who was tested on 15. I'll have to confirm that information, but it's I think I don't necessarily think that they're all connected and it's the same person that I'm talking about, and I can get back to you on that.
Okay, thank you.
Any questions from Blackburn?
Just looking at the report from the school board yesterday, there are now 2 cases at Riverside and 2 cases at Tecumseh Vista Elementary, 1 at Tecumseh Vista Secondary. Are any of these connected in any way?
So as we do the testing at the schools that are in outbreak, we also do the testing of siblings and any potential, transmission in other schools based on cohorts and their activities. So the cases that we're seeing in other areas are, some of them are linked to cases that we're already aware of based on the relationships and the either household or other high-risk contacts.
Okay, so not necessarily an outbreak then. And sorry, can you just repeat the number of recovered and number of active cases? The line kind of cut out and your website seems to be down right now. Oh, it's back. Never mind. Okay, thank you.
So for the resolved cases, 2,989, and right now we have 315 active cases that we're following.
Thank you.
Any questions from the Windsor Star?
Yes, good morning, Doctor. Good morning, Teresa. Can you tell us more information about this new community outbreak? What kind of lodging facility is this? I see it's called Riverside Place.
So it's a class 1 lodging home that supports some of the high-risk population with many and they have shared areas, they have private rooms, and that's why we are working with our city, our hospital, our community partners, primary care providers, CHC, EMS, to provide support and offer testing on site. Public health is managing the outbreak aspects of it, but the rest of the community is coming together to provide their healthcare needs as well as their basic needs such as food and other PPE, all the other things that they need to stay in isolation there. Supposedly all of them are considered as high risk because of their exposure and their living environment.
And do you have a number of how many people live there and are currently self-isolating?
So there are roughly 40 people who are in that lodging home, but again, because the transient nature of the population and the number of people coming in and going out at different times, and if you recall, we issued a public exposure notification on that residence as well because of some of the events that happened there. So we are working with all our partners to make sure that there is no further transmission happening.
And finally, do you know how many people have tested positive there so far?
I believe the number is 3 in total, but again, they have done a lot of testing yesterday at the facility, and we may get more positives either today or tomorrow.
Okay, thank you.
Any questions from AMA 100?
Chief, I just want a clarification. So the university residence outbreak, that has been rescinded now?
Yes, that was rescinded yesterday after our session yesterday.
I'm not sure if this is for Teresa or Dr. Ahmed. With that get-together, that party at that time, you said there was about 18 people there. I believe you said 4 or 5 tested positive. Did that number ever go up?
I don't believe so. Like it was pretty contained based on with the follow-ups. So I don't believe there were any further cases as a result of that.
So does that mean that residence building goes back to the new norm that they had in place?
Yes, and they probably will continue to do some of their practices because they were enhancing their cleaning and they had closed down one of the lounges, but they would be able to go back to their previous plan, but it would be up to the university on how restrictive they want to continue based on this particular outbreak.
So I have a lot of questions today. When it comes to the long-term care residents, just a few weeks ago, even a couple of weeks ago, there was no outbreaks whatsoever. Now we're at 5, I believe. How is this virus getting into this facility? These facilities, excuse me.
So obviously the many of these residents are there. So there are only 2 ways to bring the virus in: a staff member because of their exposure outside of the facility, or a resident who is maybe leaving the facility for any reason, for personal reasons or for social reason, and then coming back and bringing it to the rest of the people. In most cases, what we have figured out in these outbreaks is it's a staff person, and while they're wearing all their PPE and doing all their symptoms, they're testing on a regular basis. But what happens is, even as part of their asymptomatic surveillance testing, if they're positive, and they don't realize that they're positive, but because we go with the test date, and then we do more investigation, we identify their potential infectious period, which can be up to 48 hours prior, and that's what we use to identify any other high-risk close contacts. When it starts spreading in the residents, then it gets really challenging and more difficult for everyone to manage. The staff, because the staff are wearing PPE, even if they're, let's say, having their break rooms, which technically they should be maintaining all the physical distancing and wearing all of their mask every time when they are there, unless to eat, but again, maintaining their distance. Sometimes that doesn't happen. And so that's how it's spread in the staff. And rarely it spills over into the residents. And when it starts to spill over into the residents, that's where it becomes challenging. So I think there are a number of ways that we are looking at to provide recommendations, and maybe some of those recommendations will come from the ministry as well, just to even maybe not keep these shared areas open, at least for the short period of time. And then what are some of the other ways that these individuals cannot, get in close contact to spread even between one another or take off their PPEs for any reason unless they have to inside the facility. So I think there are a number of ways that we can do that, but generally it always starts with the staff, and then it spreads to other people.
Teresa, I'm not sure if you can answer this just in regards to long-term care. The residents that you announced today, and I might have missed it, but are the confirmed cases all within one home?
Yes, they are.
Okay, thank you.
The only thing that Rob, I would add to is yes, because they're all positive in such a short period of time. So we will be looking at those cases very carefully just to make sure that we are not missing anything, because it is unusual to have that many positive just in one day with testing. So just wanted to make sure that we're putting it out there as well.
Could this go back to what I asked yesterday about the field hospital? If you noticed that, and I'm not sure how many residents live in that facility, but could this be one where you might have to open up the field hospital again with Windsor Regional?
Well, I think that's a conversation that we'll have to have. The biggest issue with these long-term care home residents are the issue with dementia and some of the other, I guess, their health needs. For most of these people, that's their home, and that's the environment that they're familiar with. Removing these individuals from their home and putting them in a different place, what are the risks and benefits that we have to consider? And I think that has been always our question, that if the need is there to provide that level of support, and if it's temporary, then yes. The biggest issue when we are talking about these long-term care homes, what are we concerned about? It's generally their ability to cohort and their ability to staff that facility. And if both of those can be achieved on site, that's the goal. That's the usual approach. But if it exceeds a certain number, let's say even if the positives are there, if they are all truly positive, then they cannot give each other virus back and forth. So they can even, they are not the risk. The risk is the rest of the people who are negative, because they can be the one who can contract the virus. So there are a number of ways we are working with the homes and through our health system partners to provide staffing support, working with the hospitals whichever hospital is attached to these homes, is to provide that IPAC support. We do joint visits with the hospital. Our team goes in, the hospital team go in. We work together to identify those cohorting plan. And if it works, it works. I know, except for the initial one, when many people were transferred from one long-term care home to the field hospital, most of these outbreaks we were able to manage in the home. There were, I believe, at least once or twice when we had to move some positives from the home to the hospital rather than to the field hospital. So that happened, but I think we'll have to look at the overall health system capacity, capability to either provide that support on site, which would be best. If not, then we'll have to have that discussion whether we're thinking about the field hospital or maybe even moving some of these people with high medical needs to be transferred into the hospital.
Thank you. Apologize to my colleagues for asking a couple more questions.
No problem.
Any questions from CTV?
Yes, good morning, Dr. Ahmed. Good morning, Teresa. Good to see you again, or to talk to you again, I should say.
Good morning, Bob. Long time no see.
Long time. Hope you're well.
Yeah.
Couple of things. One is the talker today, and yesterday for that matter, is the picture of the mayor and that group in a restaurant setting. So I guess the first question is, I mean, he was on the radio this morning talking about, you know, his remorse and whatnot, made a mistake. We're curious, like, is he going to be on the hook for a fine, or is that long gone? Is that just, you know, a forgotten thing right now?
So from our perspective, the way everything is, you know, we understand the legislation, regulation. It's very difficult for us to charge someone when the officer is not on site to observe the infraction. So if we haven't seen that, so that's one of the things. The other is obviously, you know, when looking at just the pictures, I know the mayor's already is taking that step to acknowledge and accept. But even just the authenticity of some of these evidences, sometimes it comes into question. But from our perspective, if our staff were on site and if they noticed that infraction, they probably would have issued the ticket.
Just to expand on that now, Mike Kaycock asked a question I thought was relevant, so I just thought, you know, I'd throw it at you, see what you thought. Is the information, I mean, it's information overload. There's a lot going on right now. So do you think a lot of the information is getting lost on the public right now?
Well, we know that this pandemic is affecting everyone in many different ways, and I think some people are feeling that way, that there's a lot of information coming their way. And one of the key things, if I have to go back into the beginning phase of the pandemic, what we have always said, and I think even every day, me and Teresa, when we are sitting here every morning, the purpose is to make sure that we keep the community up to date. Where are the information sources people can go and get information, the credible information, the most up-to-date information? So our website typically provides that support to go and monitor our website with all the case counts, all the regulations. We have created just this new page in our webpage, which is the pandemic status indicator. And if you go, our team has really worked to put all those instructions right there on that website. So when in doubt, you can go and always check. And obviously, I think the other benefit of having this provincial framework is the weekly update that is happening with the province. So expect to see what happens on Friday. So if I'm a resident here, I would like to know what is my community status this Friday. What would be the additional restrictions that would come in? So I think we'll have to be mindful that yes, there's an information overload, but it's also our responsibility to stay on top of that information to make sure that we are not missing out on key pieces of information that would be essential for our community. And we hope that people are accessing those information. And if there's any gap, if there's any additional need, please let us know and we'll do that. But the whole purpose of me and Teresa sitting here every day is to make sure that we are available to you and through you to the community to ask questions, to understand what is going on, whatever we can share. That's the whole purpose, and trying to streamline everything to make sure that, you know, it's easy to understand.
Okay, so yesterday I ran into a situation where I was doing a story, and minor hockey groups around Essex County, there's a lot of confusion going on. So, you know, us moving into Orange, you know, it was thought that all games had to be halted, so they weren't able to do their bubble games anymore, right? And then later on in the day, you know, it was, I guess the legislation was, or the rules were changed at some point over the weekend. Somebody caught it, but didn't, you know, I mean, let's say the word didn't get out fast enough. So then all of a sudden later on in the afternoon, oh, games are okay, so it's all status quo. But I guess the initial reaction from everybody moving into Orange was, okay, there's no games. And that's what the rules provincially said. But then they were changed at some point and nobody caught on. So who's responsible for getting that information? And who should the public rely on in terms of getting that kind of information right away? Because, you know, sometimes it's just slow going and that's just the way it is, right?
Yeah. So good question, Bob. And I think we are all trying our best to make sure that we are providing that information. So what you're referring to, our team noticed on that as well. And I got some calls from some of our community partners as well on the topic. We generally rely on our communication with the ministry. Sometimes it's a formal communication that we receive in advance of any changes. Sometimes there's informal communication that we receive from the ministry through their website or through their communication that's shared more broadly. The specific, I guess, relationship to the games, it was posted on error on the government website, which they fixed it. And obviously, if you have to ask me when I am seeing what is written on the government website, I'll just quote what the website says. And the moment it changed, I think we changed it on our website as well, and then provided that explanation to the community partners who reached out to us. So sometimes.
So in this case, they might have. Sorry. So in this case, they might have forgotten to mention it to you. Like, you know, it might have been just one of those. Well, we just changed it, and they just didn't tell anybody, right?
Yeah, no, I think what it was just posted in error, something that should have been in the red category. They posted accidentally on the orange category for that game section. So, and they rectified it. Yeah, sometimes when these changes happen, they don't necessarily let us know that, yep, the information is corrected or fixed. Maybe just update that.
Okay. Well, I'm just worried about all the parents, because there's a lot of people that play hockey, and you know, I mean, I know one association went on their website and actually said games are canceled and had to recant after finding out the hard way that, you know, the rules were changed. So that's why I just, like I said, information overload. So.
Yeah, no, I get it, Bob, and I think as best as we are trying. My team, we always try to post information on our website, which we have reviewed, and making sure that it's coming from the right resource. We try our best, but again, sometimes if the source is information where this is coming from, if that is incorrect, it makes it very difficult for us to own everything. But we'll be on top of it as much as we can.
Oh, fair enough. I appreciate it. Thanks for letting me hash out that topic.
Okay, no problem.
Any further questions from CBC?
Yes, just following up kind of on DTV's question there, but you know, you did say that you wanted to crack down on people breaking COVID rules, and the mayor admitted to it, and the restaurant admitted to breaking these rules. What did you think when you saw this, and why are they not being fined for this?
So one thing that I already mentioned is, based on how we enforce all of these things, it does require our officers to observe the infraction, or in extreme situation, if we know that there's a blatant disregard of the rules, then they can make that judgment call on site. What we know from the discussion and what's out in the media is the mayor is already out there, and I think he has spoken what he felt it's important. We feel that, like always, as I have said this to our community members, we all have a role to play. We all have to do whatever we need to do. And I think our message will continue to be the same, to just follow those guidelines and making sure that you are doing your part, and everyone else is doing their part to keep everyone safe. And in these events of violation, our staff are taking actions and are issuing charges as needed. Okay,
and we've seen kind of a number of cases arise in schools. I know the public school board has had quite a few in the last week. Could the health unit locally decide to close all schools? And if so, at what point would you kind of decide to make that call?
So that's a very good question, and I think we are looking at the information and the understanding of this outbreak. I think that would be a very important test case for us to understand what happened at Bagley, and what kind of transmission pattern that we are observing, and if that transmission happened as a result of something that we can fix, obviously we would want to do that. But if some of these things are something that we cannot control, And if the community gets to a point where we are seeing a widespread transmission that puts all these children at risk at school, then we'll have to make that we'll have to have that discussion locally first within our health unit, with our local school board, and then maybe with our ministry colleagues, with the Ministry of Education and with the Ministry of Health, to get their perspective as well. I know that there are obviously ways to mitigate the risk, but then there are also ways to understand that what kind of unintended consequences we are bringing in when we are shutting down these schools. There are already some conversation with the benefits of learning online versus learning from home, learning on site, and which method is the best method, just from a pure learning perspective. And then the other aspect, as we all know from the school, when children are going to school, there are a number of other social skills that they're learning, social and mental well-being that they're getting. So it would be a good discussion once we have the results back from Begley to understand what happened and how the transmission happened and spread across the school. Before that, I think would be hard pressed to say that the school should be closed in any ways, but that's a question that we will continue to ask locally, internally, as well as with our colleagues.
Okay, thank you.
Any further questions from Blackbird?
Yes, just to the point with the mayor. I know that you couldn't charge for this, but just as a piece of general advice, isn't the advice that you're only supposed to be going to restaurants with people in your household, not just 4 people? You can't meet 4 people at a restaurant today and then a different 4 people tomorrow. You're still supposed to be keeping those close contacts?
Well, I think we've always said that the best thing is, you try and restrict your close contacts to the people that you live with, and as opposed to having other people in your list of close contacts. Some close contacts obviously you cannot avoid, but there are other close contacts that I think people should try to avoid at their best. So that's been my recommendations right from the beginning. That's why we try to not to have any meetings, anything related with with people coming together at the health unit, and that has been our approach. And we strongly recommend everyone in our community to follow the same, and not to have any close contacts, any gathering with people that you do not live with.
Thank you.
Any further questions from the Windsor Star?
Yes, I'm wondering why the place of worship outbreak has been considered a workplace outbreak. Was it between people who were working there? Can you tell us more information about that one?
Yes, it's between people who were working there.
And is there a high risk in that situation for members of a congregation that may have been attending, or anything like that?
Yeah, that is correct. So the people who attended the church, they could be at risk. That's why we have declared the outbreak there.
And then separately, I'm wondering about asymptomatic people, because some people try to downplay the severity of COVID-19, saying that, well, a lot of people don't have any symptoms at all. With the change in testing criteria that you have to have symptoms for the most part to receive a COVID-19 test now, are we able to track that data anymore of how many people who are tested are asymptomatic, or would that be skewed based on the fact that you, for the most part, need symptoms to get that test?
That is correct, Taylor. I think that data definitely would be skewed because we don't have that pool of people to say that who is asymptomatic. But just to even build up on that, to say that yes, we're not even testing the asymptomatic. Let's say, 20% of these people are asymptomatic, or 30% of these people are asymptomatic. you can pick whatever number you want. But the person positivity that we're seeing with all these people with symptoms is very high. We are coming close to, I think, 3% here locally. I forgot the exact number, but I think it was 2.9% or close to 3% that we have reported last week, which was very high compared to what we were reporting back in the peak of our first wave, which was close to 1.2% or 1.3% of percent positivity. And the number of people that the cases, the active cases, the number that we are reporting daily, this is based on people with symptoms, and this is based on people with who are identified as close contacts. So we already know that these are the cases, and whatever number you want to pick, 20%, 30%. So that means those people are also out there. And if you're doing some kind of a risk assessment, so you'll have to factor in the people who we know and the people who we don't know, and how many of them are out there in the community. So if you do all those maths, you can realize that the risk within the community could be much higher than what we can report based on the numbers that we have.
Based on that suggestion that the risk is much higher than you're able to report right now, is there a current need to expand testing criteria, maybe back to whoever wants a test can get one, or do you think it's reasonable enough to tell people, based on the data we can provide, we know how severe it is, but it's even worse than what you're seeing here?
So I think, Taylor, that's a good question. And I think, every time when we're talking about any kind of policy decision, any broader population health impact decision, it's always limited by the resource. And if we have unlimited resource, then yes, we can say that, it's open, it's available, do whatever you need to do to get on top of that. The risk is if we open it up for all the asymptomatic, and again, I don't want to speak for the province, I'm just speaking from my expertise as a public health specialist. If you open up this testing to everyone and anyone, the challenge is you will be missing a lot of significant people who need follow-up. So you have a limited capacity at the lab, let's say 40,000 if the province can test, and every day you are testing 60,000 people every day. So now you automatically have a backlog of 20,000 every day. And then if backlog continue to increase, you risk missing people who are positive and symptomatic to get their reports back in a timely manner for public health to do the case and contact management. So that's one aspect of it. And then let's just even taking it back from the asymptomatic transmission piece. And again, those are a very area that is currently being researched heavily in terms of the asymptomatic carrier versus people who are asymptomatic and they're spreaders. The verdict is still out there, but compared to someone who is symptomatic, them spreading the virus would be much, much higher compared to those who are asymptomatic and then they are spreading it to other people. The likelihood is very different, and for asymptomatic people, it would be very low. For symptomatic, it would be high. So from a population health lens perspective, where is the most value for all your resources? It would probably be on the symptomatic people who are at a risk, and then everyone else who's linked with an outbreak. So those are some of the decisions that have somebody high up has to make those decisions. Locally, I think still it's all dependent on the resources. I think we have to focus on the understanding that what are some of those preventative ways rather than thinking about chasing after the fact that it's already happened and it's already spread. And public health approach, we've always been that way to make sure that we have all those systems in place right at the upstream thinking that how do we prevent that? And some of those recommendations are designed that way to say that if you're limiting your number of close contacts, so even if you're symptomatic, even if you're infected, you are unable to spread it to others. Mask, cloth mask, facial covering from the source. So even if someone who's infected, if they are wearing that cloth mask, they are not able to spread it out to other people. So all those measures are there in place from a prevention perspective, and then down the road, we can continue to chase after the cases and do the case and contact management to prevent that. So we need to apply that population health approach in understanding this pandemic, rather than trying to focus on just some of these issues that are currently being managed by our acute care hospitals or our primary care providers, health system partners in general.
Okay, thank you for that explanation, Doctor.
Any further questions from AM 800?
Dr. Ahmed, if we see the numbers in this 50 range, even higher, or in the high 40s, your gut telling you that next week we could be in red status?
Well, I think the numbers are there, and the good thing is people can understand the number much more easily when the provinces come out with their criteria for moving any region into different zones. And obviously, recognizing that's our community, and it's just about a month ago we were having a good time in terms of looking at our case counts and how quickly we have come to this part. And I think it would be unfortunate that we have to go back to a place where we were with respect to all these restrictions and businesses not able to operate the way they are operating right now. But I think the numbers are the numbers, and the province will be looking at those numbers. And as best as a local public health, we are trying to do our part in terms of preventing many of these cases through education, through enforcement, through support. And still we're seeing the number of cases increasing, and we will be at a risk of moving into a different restriction level in our region.
And finally, sorry, one more quick question about the mayor. I know you were not in the photo, but on that day, you and all the mayors in our area held an hour-long news conference. I guess just your message to residents, do you feel that news conference was a waste of time, or maybe just your initial thoughts when you saw that photo? Were you shaking your head? Because earlier in the day, you and others spent an hour on a Zoom conference with us and the public.
Rob, the only thing that I can say is both Teresa and myself, we are living and breathing, maybe I want to call it a nightmare, not even a dream, of COVID pandemic right from the month of March. Both of our lives and our staff life have been impacted by it significantly, and we're not doing what we were doing before. It's a change, and I think all of us need to show and lead by example, and not only just to show. I think it's more to feel. What do you do? And I think we have to be responsible. We have to do what is best for me, what is best for my family, and what is best for my community. And all of those thoughts need to come into play when we are doing that. Every time that I am saying something here, obviously I like to think how it will impact me, how it will impact my family, and if I'm not following any of these measures, how it will impact the rest of the community. If I get sick, if I get infected, what would happen? And surprisingly, I shouldn't say surprisingly, but I think Teresa and I, sometimes we just have this talk and we say, hey, don't get sick. Don't contract COVID because I cannot do it on my own. And she says exactly the same thing back to me. So I think this is also one of those responsibilities that we feel here, and we want to make sure that everyone feel that way. The community needs that, and all of us need to be in this together to support everyone. And just I think it's we have to be more responsible. That's all I can say.
Okay, thank you.
Any further questions from CTV? CTV? Bob? Okay.
Sorry, I was on mute.
Oh.
Sorry, doctor. Yeah, I forgot to hit the button. Rookie. Can we reverse this momentum of the trend, or in staying orange, or are we at the tipping point ready to fall over in terms of moving to red?
I think with the cases that we are seeing we are very close to the tipping point. I think I use my optimism hat every day, and Teresa knows that more than anyone else. I try to use my optimism hat, and I still feel that we can turn it around. And our community has done an excellent job back in the past, and we just need to do it again. I know, and I totally get it. People are tired. I am tired too. Trust me, I am. Like, I haven't taken any vacation days. Teresa hasn't taken any vacation days. We're not doing anything other than thinking about COVID. Even in my dreams, I'm thinking about COVID. So trust me, we know that part. And it's the end is near. All I can say, it's the we have got good, promising news results from the vaccine front. There's a lot of work that's been happening right now to deliver the vaccine. It's not going to last forever, and it's I think somebody was reporting it as it's a marathon, maybe considered as an ultra marathon, that we are in it right now. We have to just pace ourselves, set eyes on the prize right now, which would be the end of COVID, and it can only happen when we follow all these measures and we don't tip over. We don't want to be in a state, remember, and I think people forget some of these things, and I want to remind, in the beginning, if you recall, we were talking about large number of deaths, hospitals getting overwhelmed, like they have seen in New York, they have seen in Spain, they have seen in Italy, people making those tough choices. Even in our community, we were talking about a large morgue where we can keep the bodies if people start to die in this type of pandemic. We didn't get there. And again, it's not a fear mongering, it's just the reality. People died, people could die, and we don't want to be there. The biggest problem, what I can see, is when you're preventing something, nobody knows, nobody remembers, nobody acknowledges. But if something happens, then you will come back and tell me and ask me, what did you do not to prevent this? And I said, well, I've been talking about it, nobody listened. And when I'm saying that, what could come, people can question me as, that if I'm fear mongering, and if I'm talking about things that doesn't exist, there's no evidence. There is, and all I can say is public health science is a specialty. It's a specialty. I've gone through the entire specialty training to be the physician that I am here. I'm not someone who doesn't know about public health, who doesn't know about population health, who doesn't know about communicable disease control. So we know how this pandemic evolves, what works, what doesn't work, what we know, what we don't know, and how do we control the disease, how do we manage the pandemic, how do we manage the outbreak. So we know that, and that's why our recommendations are there to prevent that from happening. Once it starts, it's very difficult. So it is important that I think people know that the end is near, and we all need to be sticking together, supporting each other, and take everyone with us. And I think that's the key part. If we cross the finish line, once we declare the pandemic is over, we want to take each and every one of our community members with us. We don't want to leave anyone behind. We don't want to leave and behind, to be blunt, we don't want to leave people dying and then only us who can move and follow that and think, it doesn't affect me, I am fine. Even if it affects me, I'll be okay. No, as a community, we have our responsibility. We want to take everyone with us and cross the finish line and say we have conquered COVID.
Amen to that. I'm sure I say this for a lot of people, but we're all crossing our hands. We stay in the orange and don't move to red later this week. Have a good day, Doctor. Teresa, thank you.
Thank you.